Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So from today, we are going to deal with a new topic that is admission and discharge. So in today's session, I'm going to teach you about what admission is and what are the various procedures that you as a nurse should follow when you are admitting a client. So now we will first move on to the definition of admission. So what do you think admission is? Here, admission is defined as the entry of patient into the hospital or to the ward for any therapeutic or diagnostic purposes. So here, admission simply means that it is the process of allowing a patient to stay in the hospital in order to carry out any investigation, observation, or to provide treatment and care for the patient. So admission is also of two types. The first one is the emergency admission and the next one is the routine admission. The first one is emergency admission. So what do you mean by emergency admission? This emergency admission is a type of admission in which the patient is admitted in the hospital in acute condition but will require an immediate treatment. This can be in case if the patient comes to the hospital with cases of road traffic accidents, falls, poisoning or any heart attack. So here what will happen is that the patient will be coming to the hospital or to the healthcare facility with any acute condition, but this condition will require an immediate treatment. Now moving on to the next, that is the routine admission. So what do you mean by routine admission? Here routine admission is nothing but the admission of a patient into the hospital in order to carry out any observation, investigation, medical or surgical treatment. So this treatment will be given according to the condition of the patient. So for example, here it can be for patients suffering from hypertension or diabetes. These patients will require treatment but not an immediate one. So they can come to the hospital, they will get admitted, then various diagnostic procedures, investigations will be performed, and then treatment will be given. So moving on to the purpose of admission. Here, what is the first purpose? The first purpose of admission is to receive the patient. So after receiving the patient, you should make sure that you provide comfort and safety to the patient. And then as a nurse, what you must do is you must be the one to provide an immediate care to the patient. But not only providing care, you must also assist the patient in order to help them, adjust to the particular environment. And you as a nurse must also try to maintain a good interpersonal relationship, not only with the patient, but also with the family members. So these are the purpose of admission. So what does admission involves? Here, in order to admit the client, you need an authorization from the physician. After the physician has authorized that this client must be admitted, you must then collect all the billing information from the admitting department. Not only that, but you must also complete the admission process, documents all the patient report and record, and then you should also start with the treatment which was prescribed or which was ordered by the physician. So these are the various steps that is involved in admission. So what is admission? Admission is defined as the entry of a patient to the hospital in order to carry out any diagnostic or therapeutic purposes. We've also seen that there are two types of admission, that is the emergency as well as the routine admission. We've also seen that there are various purposes for this admission, that is to receive the patient, to provide medications, to make them feel safe and comfortable, and also to help them adjust to the hospital environment, and also to maintain a good interpersonal relationship between the nurse and the patient. So moving on to the next, that is the unit. So what do you think is a unit? A unit is a place where the patient will be kept during the hospital stay. So here it is the responsibility of the admitting department to inform to the particular unit before a patient is being admitted. Why? Because if this is informed, then the nurses can make the necessary arrangement in order to receive the patient in that particular unit. So how will we prepare a unit? So as a nurse, you must prepare the room, you must prepare the treatment table, as well as you must prepare all the equipments which may be required in order to provide treatment, such as the linen, locker, wheelchair, stretcher, discharge sheet, history sheet, investigation record, nurses record, intake output record, TPR sheets, and whatever equipments which may be necessary in order to provide care to the patient. All these should be prepared. You must also ensure that there should be adequate lighting as well as proper ventilation. So these are the various things that you need to prepare before you admit the client to that particular unit. As you all know, that patient can be admitted to the hospital from various sources. It can be from the outpatient department, from the casualty, or from the labor room. So how will we admit a patient from the outpatient department? This can be when the patient comes to the healthcare facility in order to consult the doctor. The doctor may find out that she or he is suffering from any condition which needs to be treated immediately, so he can then advise the particular client to come and get herself or himself admitted. So this is the way through how we can admit the patient through the outpatient department. So next is from the casualty. So as we all know that if any emergency case come to the hospital, the first thing is they will be sent to the casualty so that immediate treatment will be provided. So after an immediate treatment has been provided for the client, they can then admit the client to various wards in order to carry on the further treatment. So next is the labor room. So how from the labor room? Here, if any gynecological or obstetric patients has come to the hospital, or if a mother has come to the hospital for the delivery of the baby, after the delivery has been done, then these mothers can also be admitted to various other wards in order to carry out their further treatment plans. So now moving on to the procedure for admitting the patient. So what is the first procedure here? The first procedure is to meet and receive the patient. So before admitting the patient, the nurse must make sure that she identifies the client. She must make sure that she must introduce herself and gather all the necessary information from the patient as well as from the family members. She must assist the patient to the treatment area, and she must also make sure that she maintained a good interpersonal relationship with the patient so that the patient will feel comfortable. And then also if the patient has to change her clothes to the hospital gown, you can also advise them to do so. So then after you have met and you have received the patient, the next thing is you should record the medical and the social data. So here the clerk record section must record all the data which is essential for the identification of the client. She must record the social as well as the medical data. So what do you mean by social data? Social data is nothing but the identification, the age, the sex, the marital status, the religion, the occupation, education, etc. Whereas the medical data consists of the diagnosis, provision of diagnosis, as well as the duration of illness. So this is the various social and medical data that a nurse must collect from the patient. So the next step is to perform the examination and the evaluation procedure. So after you have met and received the client, after you have recorded the social and the medical data, the next thing is for you to perform all the examination which is required as well as to evaluate the condition of the client. Here you must also assess the vital signs of the patient. You must assess the lab reports. Then you must also collect the history of the patient as well as perform the physical examination. You must also coordinate with the physician and carry out all the initial orders, as well as you can also provide the treatment for the client. So after you have met and received the patient, after you have recorded all their data, and after you have performed all the examination and the evaluation procedure, the next is you have to orient the client to the particular unit. So here as a nurse, what you can do is you can orient them on how to use the call bells, the telephones. You have to orient them to the various equipments and instrument which is present in the particular unit. You can also orient them to the other healthcare members, and you can also provide the necessary information such as the visitor's timing, the rules, the policies which the hospital follows, as well as the treatment schedule. By orienting the client and the family members to these things, it will make them feel more safe and comfortable. Now moving on to the next one, that is the observation of the client. So as a nurse, it is very important that you must observe the client. By observation, you can make out through their facial expression if they are suffering from any emotional disturbances or if there is presence of pain. So as a nurse, it is your responsibility to observe the condition of the client, to observe if the treatment is helpful or not, or if the client is having any side effects. So here, any discoloration of the skin, such as presence of cyanosis, jaundice, or facial paralysis, should be noted. The vital signs should be noted, as well as if the patient is having any complaints, these should also be noted so that it can be communicated to the physicians or to the other healthcare team members. So now moving on to the next one, that is following the patient's orders. So as a nurse, it is your responsibility that you must follow all the orders which is given by the doctor. If the doctor is advised to perform any lab test, you must do the immediate arrangement. If the doctor has advised you to perform a bed bath, you must provide bed bath to the patient. You are the one who is responsible for providing all the medications, to carry out all the procedures, as well as for having a constant supervision on the client. By doing so, you will be able to make out if there is any complication that can happen to the client. Here, you are also responsible to record the patient's chart. The next is the care of the valuables and clothing. So here, if the patient comes to the hospital, if she is advised to get admitted, we must advise the client that she must change to the hospital gown. So all her clothes must be handed over to her family members or to her relatives. In case if there is absence of her relative or the family members, the clothes must be numbered, labeled, and kept in store until it is handed over to the family members. And here it is also responsibility to encourage the client to hand over all their jewelries or their clothes or any other valuables which is present with them. And the last one here is the transfer of patient from one ward to the other. So this transfer of patient from one ward to the other can only be done if the doctor has advised or has ordered to do so. So before you transfer the patient from one ward to the other, you must make sure that all the chart must be up to date. You must also make sure that the medicines, the all the lab reports, the x-rays must also be sent along. As a nurse, you must also make sure that you must communicate the purpose of transferring the patient from one ward to the other in order to reduce the anxiety level of the patient as well as the family members. So these are the various procedures which is involved in the admission of a patient. Now moving on to the next one, that is the roles and responsibility of a nurse in the admission procedure. So here, what is your role and responsibility? As I've said, that the first thing is arrange the patient unit. After everything has been arranged, then you should receive the client. So as soon as you receive the client, you should make sure that you must first introduce yourself as well as collect the data of the patient. After collecting all the necessary data of the patient, you must then orient the patient and help them adjust to the hospital environment. You have to orient them to the various equipments, instruments which is present. You have to tell them about the rules and regulations of the hospital, and you have to make sure that you maintain a good IPR with the patient as well as with the family members. Then the next thing here is to complete the patient admission chart. You must assess the vital signs of the patient. You must assess the vital signs of the patient. You must collect the history of the patient. You must perform the physical examination. Then you must also administer all the medications, carry out all the investigation which was being ordered by the physician. You must also make sure that you must be friendly and courteous with the patient as well as with the family members. Make proper observation of the patient condition. You must also make sure that you first communicate to the patient and the client about the benefits of performing each and every procedure. As a nurse, you must also make sure that you must create an environment which is very suitable in order to enhance the comfort level and the safety of the client and the patient. So these are the various roles and responsibility of a nurse in the admission procedure. So now we have come to the end of this topic. So in today's session, we have discussed about admission, about the types of admission, purpose of admission, about unit, about how to prepare a unit, and the various admission procedures, as well as the role and responsibility of nurse in admission procedure. So I hope you guys have understood this topic. Thank you.